Have you ever wondered why you feel inexplicably tired or uncharacteristically irritable? Could it be that your brain is not getting enough oxygen? Could you be suffering from anemia? Let's delve into the mystery of anemia, a condition that's more than just feeling worn out or being in a bad mood. You see, anemia often presents itself through symptoms such as fatigue, irritability, and difficulty concentrating. These symptoms may seem general, but they could be your body's way of signaling a deficiency in red blood cells. And when these cells, responsible for carrying oxygen to your brain, are in short supply, it can impact your brain's function and your behavior. But how does this all connect? How does a shortage of red blood cells affect your brain and behavior? Well, that's the fascinating part. Anemia is more than just a shortage of red blood cells. It's a condition that can have a profound impact on your brain and behavior. Anemia can be caused by a variety of factors, from iron deficiency to chronic diseases. Now let's delve deeper into these causes. Iron deficiency, the most common cause, happens when your body doesn't have enough of the mineral iron. This deficiency leads to fewer red blood cells, which are crucial for carrying oxygen to your body's tissues. Then there's vitamin B12 deficiency. Without this essential vitamin, your body can't produce enough red blood cells, leading to anemia. Chronic diseases such as kidney disease or cancer can also lead to anemia. These conditions can interfere with the production of red blood cells or cause hemolysis, where red blood cells are destroyed faster than they can be replaced. Infections, certain medications, and inherited disorders can also contribute to anemia. These diverse causes all lead to a common effect: a decrease in the oxygen-carrying capacity of the blood. Understanding the causes is the first step towards addressing the effects of anemia on our brains and behavior. So how does anemia affect your brain and behavior? Let's delve into the neuroscience behind it. Firstly, it's essential to understand that our brains are oxygen-hungry organs. They consume about 20% of the oxygen we breathe in, even though they make up only 2% of our body weight. This oxygen is used in the process of cellular respiration, which produces the energy our brain cells need to function. Now, in anemia, the number of red blood cells or their oxygen-carrying capacity is decreased. This means less oxygen gets transported to the brain. As a result, our brain cells might struggle to produce enough energy, leading to a myriad of cognitive impairments. You might find it difficult to concentrate or remember things. Your thinking may become slow or fuzzy. It's like trying to run a high-performance car on low-quality fuel. It just doesn't work as well. But the effects of anemia on the brain don't stop there. It can also impact our mood. You see, our brain regulates mood through a complex network of neurotransmitters. These are chemicals that transmit signals throughout the brain. Lower oxygen levels can disrupt this delicate balance, potentially leading to feelings of fatigue, irritability, or even depression. Now, if anemia becomes chronic, meaning it lasts for a long time, it can lead to long-term damage in the brain. This is because prolonged oxygen deprivation can cause the death of brain cells. Over time, this could result in permanent cognitive decline or behavioral changes. This is why it's so crucial to catch and treat anemia early. By doing so, we can help protect our brain and maintain our cognitive health. However, it's also important to remember that everyone is unique. The exact symptoms and their severity can vary greatly from person to person. It's always a good idea to consult with a healthcare professional if you suspect you may have anemia. Anemia's effects on the brain and behavior can be subtle but significant, impacting everything from your ability to concentrate to your mood. Now that we understand the impact of anemia, what can be done to manage it and prevent its potential effects on our brains and behavior? Addressing anemia begins with understanding its root cause. If it's due to a deficiency in iron, vitamin B12, or folate, dietary changes may be recommended. Increasing consumption of iron-rich foods like spinach, red meat and lentils, or B12-rich foods like fish, meat, eggs and dairy can help. In some cases, vitamin supplements may be prescribed. Medication or medical procedures may be necessary for more severe cases of anemia, or if the cause is a chronic illness. It's important to remember that each case of anemia is unique, and treatment should be tailored to the individual. Early detection and regular checkups are crucial. If left untreated, anemia can lead to severe health complications, including its effects on brain function and behavior. With understanding and proactive management, we can mitigate the effects of anemia on our brain and behavior. To recap, anemia is a condition that can have significant effects on our brains and behavior. We've explored the root causes of anemia, its various types, and the symptoms to watch out for. We've also delved into the profound impact it can have on our cognitive functions and mood. Finally, we've highlighted the importance of therapy and preventive measures. Remember, understanding is the first step towards managing and preventing the impact of anemia on our brain and behavior. Keep learning, keep growing, and stay healthy.